the breakthrough cases, it's based on current definition of fully vaccinated, which means 2 doses of Moderna or Pfizer, or 1 dose of J&J, and boosted includes an additional dose of the either of those medications or vaccines. And so that is the case when we report breakthrough cases for infection, for hospitalizations, and it's based on current CDC and other definitions of fully vaccinated. And as a point, one of his points about minuscule risk to youth, I would say to the public that probably for those 5 individuals in our county that have died that are young, every single one death is precious, but we had 1 death in under 17, and we've had 4 deaths among the 18 to 24. So I believe that is not minuscule for those families.
No, it certainly isn't. Dr. Levin?
Thank you. We've also had a number of children in our county get what's called MIS-C, which is multi-system inflammatory syndrome of children. And this is where your body is attacked by the immune response to the virus and causes significant harm to your heart, to your brain, and to other organs in your body. So, and children can also suffer from long COVID. The speaker is correct in that a minority of children only suffer these side effects. It's not infinitesimal, however. It is an actual percentage, and whether that percentage is 1%, 3%, is really not important. If that child is your child, then it's a tragedy. So the other thing to keep in mind is that if all of us were fully vaccinated and boosted, 100% of the people in the hospital would be fully vaccinated and boosted. The vaccine, even when you're fully vaccinated and boosted, won't give you protection if you're immune compromised. And there are certain conditions where people are immune compromised like that. And it's estimated that 2.8% of the American public has that severe degree of immune compromise. So at least that many people won't respond to the vaccine, and those are the people who are going into the hospital. We have, if we look at that figure that Mr. Vargas presented earlier of 81%, it's less, of course, where we're fully vaccinated, but where people have had at least 1 vaccine. And we're looking at, let's say 20, 30, 40% of the people in the hospital are, hypothetically, are vaccinated. You would have to look at that 20, 30, 40% coming from a pool that is 4/5 or 3/5 of the people in our county. That means you're having 50, 60, 70% of the hospital admissions coming from a much smaller pool. And that is why those numbers are deceptive when you look at 20, 30, 40% of hospitalized people being vaccinated. They're, because of their size, are contributing more people, or not a representative number of people as compared to that untreated, unvaccinated population. I know that's all confusing. It would be nice to have some slides to point to show that better. But that is the best I can use with